You're
Good
welcome.
morning, my name is Lisandra Santos del Castillo and I'm a WOCN student, and today we're going to do a video about stoma marking site. This is my patients, one of the nurses who work with me. So we have to start we need to place the patient first, what is going to happen, and to see what the procedure it is. If it's an ileostomy or if it's a colostomy, we have to start that either one of those procedures is going to be in a small opening to the surface of the abdomen that allows the stool coming out instead of to the rectum. And usually ileostomies is going to be mostly in the right lower quadrant, and colostomy is going to be located in the left lower quadrant. We have to explain to the patient that they can have a normal life, and this is part of the process during the stomitis. The stoma can be need to be done due to traumas, injuries, malignancies, obstruction disease, and this is dependent. And also we do the stoma marking site to ensure that the patient going to have an optimum lifestyle, reduce leaking, and avoid skin injuries. We also reassure with the surgeon, agree with our marking stoma site. So the first thing that we're gonna do in the patient, we're gonna use usually the marking disc. This is this is a wafer from one of them, and we're gonna use a marker or pen to do it. And this is an example of the ostomy, also to do education to the patients. So we're gonna mark the ostomy with the patient sitting down, lying down, and flat in the stomach. The reason is because we want to make sure like the folds, they are not in the middle. We have to check the patient abdomen for scars, tattoos, surgeries, to make sure like we're gonna have the right location for the stomach. So the first thing that we have to do is we're gonna get the patient.
Good morning.
Thank you so much. We're gonna lie the patient first or
You want me?
no, first sitting up or down?
Whatever
Okay,
you
we're
want.
gonna do lie down, because the first thing we have to do, we need to locate the rectum abdomen. The stoma usually it has to be in the borders of the rectum abdomen, and the way we're gonna, let me get it out because my hands are cold. We have to take the patient to tie the muscle so we can really see what are the limits, because it has to be the stomach in the limits of the rectum muscle. The other way that you can do, you can tell the patient, close your mouth and cough, or you can see if the patient, you are not able to do it, you can always tell the patient, bend your head down, and when they contract, you're gonna see that the muscles, the rectum muscles gonna be, and you can set it up the limits with the pen. So you can go again and set it up the limits in the rectum abdomen. You can also, beside that, you can put in 4 quadrants, like right upper, right lower, left lower, and left upper. So you want to make sure that you understand where do you want to do the stoma site. Usually it's going to be 2 inches below the umbilical line or the bell line, and in the right if it's an ileostomy, and the colostomy if it's in the left side. And the other way that you can do is you can mark a line from the umbilical to the iliac crest, and usually 2 inches in that way. That's where we're gonna do the same marking side, either for colostomy or either for ileostomy. So now that we have it lightened down, we can also do it with the disc. And the reason why also we need the disc for is to make sure that the edges, they are not touching the umbilical. In that case, I think that it can be a little lower, because we don't want, all these borders touching surface like umbilical and folds. Like this one would be a good location. So now what we have to do is make sure that the patient in different other positions is also the right fit. So come over with me, please. Sit down. So we're ordering this time the patient to sit down, and we're gonna locate in that area, and we're gonna make sure, like, in her case, she had the fold here, but we are located in the rectum muscle below the bell line, and we have this one tentative, and when we're planning to do it, you see, it does not correlate. That looks gray in case it would be either one. But it's important also that we have to mention and we have to explain the patient to point, because it has to be a visible area by the patient. So are you able to localize where your stoma is?
Yes.
Can you touch it with your finger? Yeah, and the other side?
Yes.
Also. So that is important, because for soft tissue, when the patient needs to change the pouch, it's important for the patient, in order to that, to be able to see herself in case she needs to change her pouch by herself. It's important also to mention to the patient that there are different systems. They can have a one piece, or there are two pieces, and there are different companies, and everything's gonna be depending also, like if it's in a high output ileostomy, we wanna make sure that she's gonna use an extended wear, usually two pieces ostomy, and depending the company, it can be with two pieces click or two pieces, silicone or hydrocolloid material. We also have to explain to the patient that these procedures, before the procedure, we usually suggest 2 or 3 days before soft diet to, do not activate too much the movement of the intestine. If it's in an ileostomy, it would be at the level of the ileum, follow the stomach line. That is, after the stomach, we're gonna have duodenum, we're gonna have ileum, we're gonna have jejunum, and then we're gonna have ileum. And at the level of the ileum, that's what we're gonna do the ostomy. And then we're gonna have ascending, transverse, and descending colon, mostly in the left side, and that's where we'll be doing the colostomy. So also pre-op education, we have to explain to the patient.
Protect the stoma side.
We need to protect the stomach side when we mark it.
Until, the marking until surgery.
Yeah. Oh, yeah. We also, once we recommend the patient, and once we see that this is the right ostomy side, and we're gonna apply for the patient, what we do after we mark with the marker, we usually get a tegaderm or a hydrocolloid, and we're gonna protect it until the day of the surgery to avoid that the marking came off. That's why we're using like a permanent marker. And we also explain to the patient if they have any problem with that, even if they take a shower, they have to make sure that the mark stay there. So post-procedure, it is important explaining the patient with ileostomies that the ileostomy is a high output and she's gonna lose a lot of fluid and water. So it is important the hydration based also in electrolytes. That's when we recommend Pedialyte and when we recommend Gatorade, because that have a lot of electrolyte. In case it have to be water, it have to be, it needs, because the sodium is reabsorbing in the colon, it's important for them to know that if they drink only water, because maybe they don't like Gatorade or they don't like Pedialyte, it is important to supplement it with some salt, like maybe chips or crackers, because it's gonna be sodium depletion. And if it's a colostomy, we have to also teach them about irrigation. And we have to make sure also that the patient know what is the normal finding after the surgery. The stomach should be red, viable. It can be pink as well. And it have, sometimes there are stomach who are protruded like this one, but sometimes you might find what is a little protruded like this one. And explain to her complication, like if the stomach gets darker, it's a sign of complication. They are around the wound. There can be a para-abdominal hernia due to complication, and it's find out that we have to explain to the patient what are the normal findings. The patient 6 to 8 weeks after the surgery, the stomach is going to start reducing in size. So usually when we mark it after surgery, maybe the stomach is 40 millimeters. By the time it's 6 to 8 weeks, the stomach is going to reduce size. Maybe it's going to be 35 or 30. So those are finding important, because especially if the supplies are going to be cut to fit, we need to explain the patient that they have to reassess the stomach size like after this 8 weeks. Or if it's pre-cutted, we cannot pre-cut it right away after surgery. We have to wait until the stomach have his usually the size, or we have to be, because if you cut the stomach opening too big, you're gonna have problem with your skin, you have high risk for leaking, and those are complications that it can happen, and that's why it's so important marking the stomach size. And the patient has to be comfortable with stoma. You also tell the patient to move, do exercise to make sure that his normal life, she can enhance an activity all the time. And it is important for them to know that they can have a normal life with a stoma in place, because this procedure is just for them to feel comfortable while they're doing exercise. Stoma site marking is an important trick, although there are patients and hospitals that they don't have wound care nurses specialists in this. This is an important key, because sometimes those stomas they are for life, and it is important guarantee that the patient feel comfortable and they can do their normal life with the stoma.